The coronavirus continues to spread around the world, with infections reaching the 100,000 mark globally. Here's what we know of the COVID-19. COVID-19 is an infectious disease caused by the most recently discovered strain of the coronavirus. That virus is now called SARS-CoV-2. Again, the disease is COVID-19 and the virus that causes it is SARS-CoV-2. The pathogen and the disease were unknown and came into light when the outbreak began in Wuhan, China back in December of 2019. The disease pretty much mirrors symptoms of your typical flu. The most common symptoms are fever, tiredness, and dry cough. However, some patients may also experience body aches and pains, runny nose, sore throat, or diarrhea. There are also instances when infected persons don't show any symptoms at all, and these are usually referred to as asymptomatic cases. The disease is spread from person to person via respiratory droplets. When an infected person coughs, sneezes, or exhales, he or she expels droplets from the lungs that contain the virus. You can get COVID-19 when you breathe in these droplets, or when you touch surfaces where these droplets land and then put your hand on your eyes, nose, or mouth. Catching the disease from someone with no symptoms is very low, but it's possible to get it from patients who are experiencing mild cough. This is particularly true in the early stages of the disease. The good news is most people recover from the infection without needing any special treatment. However, 1 in 6 patients becomes seriously ill and develops breathing difficulties. Older people, as well as those with underlying health conditions such as hypertension, heart problems, or diabetes, are more likely to become seriously ill. The bad news? There's no medicine for COVID-19 to date. What usually happens when infected patients are brought to hospitals is that health workers provide supportive measures to relieve symptoms. Sadly, there's no vaccine yet to prevent contracting the SARS-like disease. Antibiotics also don't work on COVID-19. Why? Because they only target bacteria. Remember that SARS-CoV-2 is a virus and they are different from each other. However, experts all over the world are working on possible vaccines and drug treatments against the disease. The WHO is working with some of them to come up with a definitive method to combat the virus. So how then can you protect yourself and those around you? The WHO says the best way to prevent contracting the virus is by frequent hand washing. You should also cover your mouth with the bend of your elbow or with tissue when you cough or sneeze. Why this part? Well, because you hardly put that part of your elbow near your eyes or your mouth. It's also important to keep a distance of more than 1 meter or 3 feet from a sick person. Well, how about those masks? The WHO only recommends wearing one if you are sick or if you are caring for an infected person.